Hi guys, this is a short video on third-party consultation scenarios. And when I say third-party, this video I'm talking about relatives coming to see you about a patient, for example, or a carer coming to see you about a patient, for example. I want to go through a couple of do's and don'ts to make these cases a little more straightforward, a little more simplified. I see these kind of cases quite a lot in our courses, and we see the same mistakes that people make again and again and again. So I just want to go through some of those just to give you a bit of clarity, a bit of focus if you get this kind of scenario coming on your practice, when you're practicing for role plays or in the real day itself. I'm Aman, I'm a GP, I'm a passionate medical educator. I want to see you fly through your exams, and this is what these videos are all about. Let's go. So the first thing we're going to talk about is a really big thing in third-party consultation is, of course, confidentiality. Now, it's a big part of third-party cases, but we often make it much more complicated than we need to. So the first thing I would say, look, I see so many people when we do a third-party case, and of course they just come and the first line they throw out, the patient hasn't even sat in the chair yet, but the first line they'll say is, oh, by the way, just so you know, I can't give information about the patient's records, but you can give me any information that you like. Almost getting a disclaimer in just because it's a third-party case. Now, I would avoid this because it puts a real negative spin on the beginning of the consultation. Straight away, there's a barrier being formed. As if you're judging that person already, they're going to come and ask you a whole lot of questions. They may not ask a single question about the patient's notes for the whole 10 minutes. Confidentiality may not be an issue at all, but we've just made it into an issue. So the first thing I say is just be normal. How can I help? What's been going on? Tell me the story. And then when they first ask you a question like, oh, do you know if my brother smokes? Or do you know if my mum came in last week? That's when you have to turn around and say, look, unfortunately, I can't give information because, etc., etc. So don't go with that trigger line of confidentiality just because it's a third-party case. Now, when you do want to talk about confidentiality and you do want to explain why it's not something that you can just, divulge information like that, rather than trying to think about explaining the principle of confidentiality, think about just flipping it back on the person. So, for example, if someone comes and says, oh, doctor, do you know if my sister came to see you last week about the pill, for example? Don't just go into the principle of confidentiality at that point and explain the principle behind it. Just flip it back on them. Just say, oh, imagine if it's a bit difficult for me. Imagine if your sister came in and asked us for information about your medical records. In the same way that I wouldn't be able to give her information about you without your permission, unfortunately, I just can't give information about your sister to you right now. Now, straight away, that person understands the principle of confidentiality because you've just flipped it back on them. It's become personal to them. We talked about this in our ethical video a little bit, but it just saves you having to go through the principle and explaining it again and again and again until someone clearly understands it. Now, second thing about confidentiality is make sure there isn't actually a reason where you can give information about that patient. So I'd always ask, if someone comes in as a third party, what is the person doing? Where are they right now? Do they know that you've come today? Have you got permission to talk about their records? Of course, if they say, yes, I've got all the permission in the world, doesn't mean you go and do it. You ask, okay, are you happy for me to maybe give them a quick call to check that? Or have you got anything written in writing, for example? But it may just it just shows that you're aware that actually there may be reasons why you can talk about this patient's records, as long as the appropriate checks have been done and you've got things in writing and things in place. So don't just completely straight away think, well, there's no way I'm going to give you any information whatsoever. Sometimes asking this basic question just shows the awareness of, okay, this is a third-party case, but there are different ways to approach third-party cases. Are they aware of what's been going on? Are they aware that you're here? Why they're not here today themselves? Have they got permission, etc., etc. So doing a bit of background work about confidentiality is very important, but a couple of things to remember at the beginning. Do not throw that disclaimer in straight away. You don't always need to throw that in right at the beginning of a case. And secondly, when you do talk about confidentiality, make sure you think about trying to flip it back on the other person, because there's a lot of the hard work for you and they tend to understand it a little bit better. Hope it makes sense. So the second thing to talk about here is the history, the data gathering part, because it's very different in a third-party case to someone sitting in front of you. Of course it is. So we're very used to when someone comes in with chest pain, we can reel out the question. If someone comes in with a fall, we can talk about all the questions. But when someone else comes telling you about that patient who's had these things, it's sometimes a little bit more difficult, and we dry out very quickly in terms of the questions that you can ask. So the first thing to remember is you can do as big a history as you like. You can ask as many questions as you like. You're not breaching confidentiality by asking about the story, tell me what happened, tell me about things that you may know that may help me understand what's going on. That's fine. You have to ask all the questions that you want, so take the advantage and do so, because you've still got to develop a story, you've still got to work out what's going on, come up with some differentials, come up with a plan. So the first thing I think about is when you think about it in the third person, we do tend to dry up and the questions tend to become very limited. Just flip it. Think that that person has actually come to see you, the person who had the chest pain has come to see you, the person who had the fall has come to see you, and ask questions in that way. When you think of it in that way, all the questions start to flow as if they've come to see you in your normal sort of practice. So, for example, when someone comes in saying, oh, my brother had chest pain earlier, ask the brother questions as if you'd be asking the actual patient himself. So do you know if your brother had any pain when he's been sitting at rest? Do you know if he's had this kind of pain before? Do you know if he's had any history of heart attacks before in the past? Did it, for example, sound like this? Do you know if he's mentioned that? Do you know, for example, if he had some trouble with his breathing? You can still ask the same questions that you'd ask the patient themselves, but just in that third person way. But it's just the way you think about it. Think as if you're asking that patient in front of you, and the questions start to flow as per normal. This is not just red flags. Of course, you've got to do your medicine right, your red flags. Ask if they've had histories of cancers. Ask if you know they had any falls. Ask if you know they've had changes in their bowel habit. Of course, you can ask these questions from a medical point of view, but also we get stumped on things like psychosocial. You can still get a lot of information about a third person from a third person in terms of psychosocial, and that might help in the way that you think about things. So, for example, do you know if your brother smoked at all? Sometimes that can have huge impacts on things like chest pain. Do you know if your brother drinks alcohol? That can be another thing that can impact things like chest pain. Do you know what he does for a living? Because sometimes what we do in our living can impact things like, heavy lifting can cause chest pain. So asking all that kind of stuff is really important. But again, just think of what you'd ask the patient themselves, but just flip it into a third person in terms of the way that you ask it. If your mind's just thinking like that, then you're going to ask a lot more questions, get a lot more of the story, be able to work out a lot more what's going on yourself, and come up with a reasonable plan and going into the second half. But if you don't think like that and you just think about third person, all your questions are just in third person, you're probably going to limit yourself to the questions that you ask, and you're going to forget quite a few, and the second half is going to suffer automatically. So think about as if that patient is actually sitting in front of you. Think about the question you're going to ask them if they came with that problem, and then just flip it into the third person, and you'll come up with a really good data gathering and get lots of ideas, both medically and non-medically as well. Third thing to talk about, double ice. I see this quite a lot. Again, we do cases like this, and when it comes to thinking about ice, when it's a third person case, often ice evaporates. There's just no ice whatsoever, because we're thinking in our brain, okay, how can I find out about an ice when the patient's not actually here in the first place? So I'd go the opposite way and say, actually, you know what, you've got to do a bit more work than what you normally do, and think about a double ice. You've got two brains to work out here, two people to try and figure out what's going on in here in terms of getting those issues out from an ice point of view. So, for example, a patient might have come in, someone might have come in talking about their brother who's got a really bad cough for the last 3 weeks, and they're really worried about something like cancer, for example. Okay, so asking about first the person that's come to see you, what is their ice? What did they think is going on? Okay, maybe they thought it was a chest infection. What are they actually worried about? They may worry that it's something like a tumor, for example. And what did they think that should happen right now? Oh, doctor, I just wanted you to see the patient. So, okay, you've got the ice of the person that's come to see you, the third party. But don't forget the ice of the patient as well. They may know what some of the things are in their brother's mind, for example. So you want to tackle that as well. So, okay, you've come to see me, that's great, and I've got a good idea of what's going on. But what about your brother? Do you know what he was thinking this could all be? Oh, my brother thought it was just just like a viral infection, for example. It's really important for you to know that and compare that to what the actual person who's come to see you thinks. Oh, you mentioned that you're worried about lung cancer, and of course people do think about that when it comes to things like coughs, but do you know if your brother had any worries about all of this, for example? Oh yeah, he was worried. He wasn't worried about having cancer. He was worried about going on some holiday in a week. He didn't know whether it would affect him on his holiday. So again, a really powerful thing to know. Maybe that's the reason why he's not come to see you today, and you can work on that later. Okay, expectations. So again, what do you think? What do you think we should do now? How do you think we should proceed? Oh, doctor, can you give him a call, or can you get him to see you, whatever it might be? Okay, but do you know what your brother thought? Like, do you know what your brother was planning for all of this was going to be? What did he think anything that we could help if he did come to see us, for example? Oh, he did think about maybe some sick note might be useful, but I don't know. He didn't tell me in detail. Okay, great. That's still important information to know. So remember, when it comes to ice in a third-party case, don't blank it, don't zero it because the face is not here. Think opposite, think double ice. There's so much information that you can gather both from the mind of the person who's come to see you and from the mind of the person who's not actually there in the room, because they still may know quite a lot about what's going on there as well. Double ice, not zero ice, and you'll build up much more information to go forward into the second half. And finally, guys, don't forget the actual third person themselves that's come to see you. They are an individual person. They have things going on in their life. You've got to reflect and acknowledge and appreciate the fact that they've got stuff going on, as well as the clinical stuff that you're trying to work out, maybe with the patient is not in front of you. So for example, so we talked about a little bit about, we did talk about ice already, you're trying to get out what's in their mind, but actually how are they coping with all of this? What are their fears about this? What's driven them to book the appointment to come and see you? Have they got underlying fears themselves? Have they been worried about their brother for the last 3 years and gone into depression themselves? Are they getting severe anxiety symptoms because of the worry of the fact that their mother is not coming to see you? Don't neglect the third party. Often that could be the first point of their issue opening up so that you can discuss it with them. So yes, of course, you're going to pay attention to the actual problem that the person they've come to talk about, the one that you've got the notes in front of. Of course, you're going to be doing all the information gathering for that and thinking of a plan how to help this person. But don't forget the person that's come to see you. They may be a long-term carer. Carers, for example, it's really important to pick up on these little cues that they're in distress, they're struggling. What is their support system? Could they, for example, or should they, for example, think about coming to see you as an individual from their point of view? Just a couple of key lines. Look, I noticed that this is clearly taking a lot out of you. You're obviously going through quite a lot. What about maybe yourself? Why don't you come and have a chat with me later on about how you're dealing with this? I think there's maybe ways that we can help you. It's just showing you awareness of the whole situation. Remember, you're not just targeting a specific thing in these type of GP-like exams. You're thinking more awareness of a global scenario, and that global scenario includes carers, relatives. Maybe this is their first time. Maybe they were so worried about coming in, about their own worries, anxieties, and depression, that they're using this as a way of coming in to get that door into the GP. Don't miss out on these little things. So always think about offering, or is there a need or a value here to offer them to come in for an appointment for themselves, just so you can focus on their issues at the same time. It might be a really nice touch, and it might be actually a really important cue that you're supposed to pick up in the middle of a scenario like this. So guys, hope that's been useful. Just a recap there. So number one, confidentiality, don't forget this. But what I would say is don't just go and throw that line out right at the beginning just because it's a third party case. Wait for them to answer the first few questions, and then when you do talk about it, think about flipping it around on them. It just does the job for you. Number two, history, data gathering. Make sure that you still get your data. Make sure you still understand the issues. Make sure you still do your red flags, you still do your psychosocial, but think of it as if that person is sitting in front of you, and all the questions will come a little bit quicker than if you're thinking about it in a third party. Number three, double ice. Don't zero your ice, double your ice. Think about the two minds that you're trying to work out here. You've got the mind of the person sitting in front of you, and you've got the mind of the patient. A lot of information sometimes you get from that kind of approach. And number four, think about the third party person themselves. Don't neglect them. They may be carers, they may be stressed, anxiety, worries. Think about maybe offering them appointments. Think about coming back talking about themselves. Again, it goes really nice touch, and it goes a long way to showing that you're thinking about that whole situation as opposed to just that particular problem that they're coming to see you about. So I hope this makes some sense. Just a general point when you think about third-party cases as well, think about talking about things in the third person. It makes, sometimes we get that little niggly feeling that I'm talking a bit too much about this patient. Just flip it and talk about in a third-party person, especially in things like the second half. So when we talk about plans and what to do, think about, when we normally see a patient who comes with these type of symptoms, we think about doing this. When we see a patient who comes with this type of scenario, one thing that goes to our mind is something like this. When we talk about it like that, and you're not talking directly about that person, sometimes you feel like you're not giving information, you feel more comfortable in the way that you're saying things. So remember, but the key thing, obviously, is not to give any information that is sitting on this person's note that you can read, that you're aware of. You can use it to frame your thoughts, you can use it to try and work out what's going on, but don't use that information in terms of telling them anything that might be on that record. That is number one priority in a third party case. But hopefully this makes sense. There's lots of other videos on our channel to do with CSA, but also AKT and GP training in general. If you want any videos making, please let me know. This one came and through a couple of requests, so I'm hoping this is going to be of some value to you. Hopefully we'll get to see you at some of our courses going forward, or some of our webinars or mocks or whatever it might be. And if not, don't worry, hopefully you're still going to get through the exam just as fine anyway. But if I have any other queries, please let me know. Others, have a great day, and I'll see you soon. Bye.